We have a total series of about 33 satellite clinics that are in small rural settings, small towns out in the countryside. These rural settings, for instance, today we're in a town of 13,000 in which we go into the country to where the patients generally are rural, they're elderly, and they have what we take care of, which is usually coronary disease or valvular heart disease. Hello, Mary. How are you today? What we're doing is we're actually trying to bring a sophisticated level of modern health care in cardiology to the rural patient. To really understand what somebody's problems are, you have to have sophisticated type of imaging technology, which is not available here. So we bring it to them. We bring either portable stress echocardiography or portable echo, so that at least we can tell the patient something definitive about where they are heart-wise. Basically, what we have now is we have digital equipment that looks like a laptop computer. And from that, we can ultrasound and throw images, digital images, into the patient and withdraw from them information that is vital to our diagnosis. Every time we make a trip to this town, I will find somewhere usually between 5 and 10 people who have a severe problem.
And since that period of time, Dr. Murphy has put 9 stents in my heart. I think Dr. Murphy is just a tremendous cardiologist that I've utilized for years, and I hope we can continue to utilize for many more years.
If there were draconian cuts in the way that things are paid for, then this would dramatically impact the rural population's access to modern health care.
Oh man, I mean, as you get older, you don't see as well, you don't drive as well, and for us to drive 3.5 hours to Little Rock is a real burden. And not only would I have to, probably get one of my kids to take off from work or something, I don't know that I could keep driving to Little Rock and back by myself.
Well, I think it would just be absolutely horrible, and I think it'd be very poor medical practice to cut that out, and I think it will actually hinder the health of many people. And I can't even fathom or imagine that they would do this.
Policymakers need to consider the fact that we have already figured out how to deliver the health care to these people in rural areas especially. And we should be very thoughtful about whether or not we want to change our ability to actually deliver care to a rural population. There are no other fallback positions for these patients, so it would probably eliminate a lot of access to modern health care for these